with surgery, you have to do a lot of risk management, right? You have to assess and balance the risk on the behalf of the patient sometimes right in the middle of an operation. How do you go, I imagine there's a lot to learn, about surgery, the mechanics of it, what's there, but how do you learn to manage those risks real time?
There's a couple of thoughts that I've had thinking about this a little bit. One, I have this vivid memory of a chief resident bringing all of the junior residents together one day when we had messed up some detail. And in the hospital, residents in training have a patient list, and it lists all the patients by floor, and there's notes what to do and all of that. And he chided us for not knowing some lab or something, and then held it up and said, the difference between this list and the list of passengers on an airplane is that we kill them one at a time.
Huh.
And I was like, and I still obviously remember that it was, and obviously we don't kill them one at a time, but it was part of his illustration of the responsibility that we have for the patients we take care of. When we're talking about risk of an operation, because it's the patient that's taking the risk, right? It's not really the surgeon that's taking the risk. You're bringing your training in to help them make a decision on what to do. And 100% of the time when I'm getting consent from a patient, I look at them and I say, what we're talking about here is the risk of not doing this procedure versus the risk of doing the procedure. And we need to go through both sides of that equation so you understand completely what's going on and that we have this common understanding of what the risks are.
So is that hard? I mean, personally, you're dealing with children, so that adds that extra emotional component. And of course, it's always easier to take risks for yourself than risks for other people. And so you comment the risk is all on the patient side, but yet on the surgeon side, you have to perform at 100% all the time. And so there is a certain amount of risks / responsibility there as well.
One day I was doing a consent for a little boy who had a malrotation. So it was a chronic thing, not an emergency thing, but we needed to do surgery because his intestines basically had not returned to the abdomen when he was in utero and the way they should, and they were essentially twisted. And so there's an operation to do that to help relieve his pain and all of that. And I went through very carefully the informed consent that we do, because that's what we're talking about here is informed consent. And including that he could lose intestine and, need other operations and have bowel obstructions. And I got all done. The mom signed it and looked at me and said, it must be so hard to do what you do. And specifically, like talking to parents about all the things that could go wrong. And the truth is that we don't dwell in all the things that could go wrong. Once we explain them and then you have all the training, it's like, I do believe it's like getting in a cockpit and you're completely trained to fly the plane. And you're also trained to look for all the things that could go wrong. And you've embarked together on this journey, understanding what those risks are. And so it's not hard once you practice it. It's hard initially.